Does flossing reduce gum disease and tooth decay? I don't think there are any dental hygienists who haven't been asked about flossing in the last few weeks. The culprit is a review published in Cochrane, which was picked up by the media and created the current maelstrom on social media. Cochrane is actually considered to be the most reliable and trusted source of evidence in the healthcare sector. And what they stated about the evidence for flossing was accurate. There is a but, so please listen in. The reasons Cochrane considered the gold standard of evidence is that they are so robust in their examination of the research process and evidence. The positive side to this is that this protects our consumers, and also when Cochrane states there is good evidence for something, you can bet your bottom dollar that it's believable. The problem is that Cochrane specialises in reviewing research that looks at medical trials, which are fairly easy to set up and correlate, such as the effectiveness of specific medications. Setting up a study to determine the effectiveness of flossing is extremely difficult because it relies on patient compliance and technique. Could we really be sure in a trial involving hundreds of people that they're all flossing correctly? So what I'm saying is the problem is the type of research that Cochrane was looking at for answers, and we in the dental profession maybe need to consider alternative methods to finding an answer to whether flossing is effective. Action research would fit the bill. It's first-person research where clinicians look to solve problems in their own environments and on their own patients. This can become a really powerful tool when outcomes of multiple studies are combined. At OHU University, we recently published 14 of our graduate action research projects related to flossing, which can be viewed in our action research library on our website at www.ohairuniversity.com. Having read through all of these studies, I can conclude that the topics of flossing is far more complex because we are not simply asking our patients to pop a pill. We're asking them to carry out a task that requires knowledge acquisition, a certain amount of manual dexterity, and a change in behaviour. Interestingly, all of those three subjects would be topics more sort of suitable to behavioural research, not the sort of number crunching research preferred by Cochrane. Also, our research discovered that the mantra of brush and floss isn't necessarily the best approach. It's a given that it's just as important to clean the two interdental surfaces of each tooth as the other three, but there are several alternative methods that are just as effective. These methods are water flossing in its various guises, soft plastic picks, and bottle brushes, which are all at least as effective as string flossing. And in most cases, they require less manual dexterity. All of these three were likely to see greater compliance in our research. Patient compliance and behaviour change were the biggest challenges to our researchers. And when a specific behavioural change technique was used, patient compliance was more likely. It can be argued that an experienced hygienist will be able to suggest the best interdental cleaning method by combining the dexterity of the patient, examining the complexity of the patient anatomy, and the overall health of the mouth. But our researchers discovered that involving the patient in this decision-making process and allowing them to make the final decision will lead to better patient compliance, as will also following up the patient at a later date. Also, when looking to discover the reasons why some patients comply with interdental cleaning and others don't, we are better looking for answers by asking our compliant patients what made them comply, rather than asking our non-compliant patients why they didn't comply. They never succeeded. How would they know the answers? And patients who are able to demonstrate a behaviour change for a month are more likely to change permanently as they begin to see positive health changes, which reinforces positive change. Finally, going back to the original Cochrane review, The entire research is based on a presumption that removing plaque will prevent gum disease and tooth decay. We all know that gum disease and tooth decay are far more complex than just removing plaque, and we have all seen patients with those diseases who have good oral hygiene. Some of our students are currently looking beyond plaque removal to reduce these diseases. Look out for these future projects in our Action Research Library. And thank you very much for taking the time to listen.